Good day, everyone. Today I'll be discussing a clinical scenario where I have a 66-year-old patient, Mr. Ivanov, who had a head injury which led to intracranial hematoma. Now, 2 days ago, he had craniectomy performed and he still has hemiplegia and facial nerve paralysis. Before going deeply into Mr. Ivanov's case, first we have to look at what is paralysis and what is paresis. First, let's look at paresis. Paralysis is the reduction in muscle strength, which leads to also a reduction or minimal control in voluntary action. In paralysis, the patient must have lost total control or inability to make voluntary movements. Now, the next question is, what does facial nerve paralysis look like? If a patient has facial nerve paralysis, you will notice a drooping of skin around the eyebrow, around the eye area in general. You will see drooping of skin under the cheeks and under the mouth. Now, this is because when the muscle loses its motor function, it relaxes completely, and the skin above it relaxes as well. Leading to the drop or the drooping of skin on the face. Now the next question is, what should you as a nursing assistant be concerned of when caring for Mr. Ivanov? Well, I think you should be concerned of intracranial pressure because clearly he had a head injury, and this is one thing that your mind should always go to. And I'm going to show you how to check in a patient if he has signs and symptoms of intracranial pressure. Good day, Mr. Ivanov. How are you feeling? So I'm going to be checking you for signs and symptoms that might indicate intracranial pressure, as this is something critical we have to always check for. So have you had any headaches recently?
Yes.
You've had headaches. Have you vomited recently? Have you felt the urge to vomit?
Yeah.
Have you lost consciousness, they said recently?
Not really.
Can you move your right hand for me? Lift it up. Put it down. Okay, so I'm going to be checking the glucose. Okay, so having done this, this is how you check if a patient has intracranial pressure. He has displayed some signs or some symptoms rather of intracranial pressure, as he mentioned, as he agreed earlier to some questions I asked, such as headaches and the urge to vomit, and that should be a sort of something for awareness that you need to check or monitor, even though he hasn't displayed other symptoms or signs. How to prevent complications in my patient, Mr. Ivanov. Firstly, I would always have to monitor my patient's vital signs. I have to monitor my patient's mood change. I also have to report any signs of infection, early infections to the nurse. I have to also carry out prevention of contracture and also pressure ulcers. I have to prevent them totally. And with this, I hope you've finally learned what to do in a clinical scenario involving Mr. Ivanov, who's had a head injury leading to intracranial hematoma. Thank you for watching this video.